When we talk about heart health, you probably hear the same old checklist, right? Cholesterol, blood pressure, blood sugar. But what if I told you your gut, yes, your gut, could be influencing all of those long before they show up on a lab test? Hi, I'm Brenda Watson, and whether you're trying to stay ahead of heart disease or already dealing with early warning signs, there's something your doctor may not be looking at closely enough. Your gut might be the real foundation of your heart health. Stick with me for a few minutes and I'll walk you through how your gut bacteria impact your heart and what you can start doing today to take back control. Let's start with cholesterol. Your liver uses cholesterol to make bile, which helps you digest fats. That bile travels from your liver to the gallbladder to the gut, where it's either reabsorbed into the liver or it exits the body through the colon elimination. Here's the cool part. When your gut bacteria is diverse with lots of strains, it pushes more cholesterol out through the stool. Less recycled cholesterol means lower levels of cholesterol in your body. And there's more. Some bacteria, like bifidobacteria and lactobacillus, also produce a postbiotic, like butyrate, that helps lower inflammation. But the best part is it helps lower LDL cholesterol, which is the bad cholesterol you do not want. Yet when your gut is out of balance, the opposite can happen. Harmful microbes start to dominate, and they can produce a compound you may not have heard of called TMAO. It forms when certain gut bacteria break down nutrients like choline, lecithin, and carnitine, which are found in foods like red meat, eggs, and dairy. Elevated levels of TMAO in the blood have been linked to an increased risk of cardiovascular diseases, plaque buildup in the arteries, blood clots, impaired cholesterol metabolism, and inflammation. So even if your cholesterol looks normal, high TMAO levels can still raise your risk for heart disease. Just remember this, it's not just about your cholesterol. It's what your gut does with it and whether it's helping or hurting your heart. Now let's move into blood pressure. You might be surprised to learn your gut plays a big role here too. When your gut bacteria digest fiber, they produce butyrate and propionate. These guys help relax your blood vessels, lower inflammation, and even support communication along your gut-brain axis. They also help regulate stress. And since stress hormones like cortisol affect your blood pressure, that's a big deal. But there's another piece of the puzzle, your gut lining. When it becomes porous, or what we call leaky gut, toxins like lipopolysaccharides, or LPS for short, can slip into your bloodstream. This toxin is one of the most dangerous and the biggest contributors of heart disease. It causes inflammation, which stiffens your arteries and pushes up your blood pressure, even if your salt intake is low and your stress is in check. This is why I teach so much about healing leaky gut. If you haven't seen my YouTube video on that, check it out. And now we're going to talk about blood sugar. Your gut plays a big role here too. Some bacteria help your body respond better to insulin. They also help release GLP-1, a hormone that balances blood sugar, curbs cravings, and keeps you feeling full longer. But that's not all. When those bacteria digest fiber, they create short-chain fatty acids like propionate. That helps your body use glucose more efficiently, avoid fat storage, and even support brain function. But here's the flip side. When your gut is out of balance or your gut lining is damaged, things work in reverse. Toxins like LPS can leak into your bloodstream, triggering inflammation. That inflammation makes your body resistant to insulin. It causes blood sugar swings and it promotes fat storage, especially around your belly. So even if you're eating well, a leaky or unbalanced gut can make it harder for you to manage your weight and your blood sugar. Now, I imagine most of you know your numbers. Most of us do. Traditional medicine often focuses on keeping those numbers in check. Your cholesterol, blood pressure, and blood sugar. and usually with medications. But here's the thing, that approach is reactive. It manages symptoms. It doesn't fix the root cause. And the truth is, many of those imbalances start brewing in the gut years before the lab work shows anything. And if you're already taking meds, that's okay. There's still a lot you can do to support your body, and your gut is a great place to start. So, what can you do? Let's keep it simple. Start with these 4 steps. Feed your gut, and your heart will follow. Try to get 35 grams of fiber a day, especially soluble fiber from oats, legumes, flaxseed, apples, and berries. Add prebiotics and probiotics to restore your gut balance and boost butyrate, the key short-chain fatty acid we talked about earlier. Support your digestion and reduce inflammation. Bitter herbs like dandelion root can help bile flow and fat digestion. Take 1,000 to 2,000 milligrams of omega-3s every day to help lower inflammation, and L-glutamine to strengthen your gut lining. Eat in a way that your gut loves and that doesn't stress it out. Focus on whole foods, high fiber, good fats, and low sugar. So lots of veggies, low sugar fruits, beans, lean protein, olive oil, and avocado. Cut back on processed junk, trans fats, and added sugars. They hurt your gut and your arteries. Don't forget your lifestyle. Move your body every day. Even just 20 minutes helps with gut motility and circulation. Lower your stress with breath work, walking, or something you love. And get good sleep. Your gut bacteria run on the circadian rhythm just like you do. Consistency is key here. The more you stick with these habits, the more you stabilize your health, no matter where you're starting from. So whether you're staying ahead of the curve or already managing heart concerns, don't ignore your gut. It's your control center and your greatest ally in protecting your heart. Grab my quick gut health guide below and make sure to subscribe for more gut smart tips. Let's keep learning and healing together.